How to do regular screening for STDs. Getting tested for sexually transmitted diseases, STDs, on a regular basis is important for protecting your sexual health and the health of your partners. This is especially true because some STDs can be asymptomatic. Asymptomatic infection refers to a situation where a person is infected with a sexually transmitted disease but does not have any noticeable symptoms. This means that the person is carrying the virus or bacteria that causes the STD, but is not experiencing any physical or visible signs of the infection. It's important to note that just because a person doesn't have symptoms doesn't mean they can't spread the infection to others. In fact, many STDs can be highly contagious even when a person is asymptomatic. This is why regular testing for STDs is so important, especially for those who are sexually active. Here are some reasons why regular testing is recommended. Early detection. Regular testing can help detect an STD early, when it is most treatable. Early treatment can prevent serious health problems and reduce the risk of transmission to others. Prevention of transmission. If a person has an asymptomatic STD, they may inadvertently spread the infection to others. Regular testing can help identify and treat STDs before they are passed on. Peace of mind. Regular testing can give a person peace of mind by letting them know they are free from STDs or alerting them to any infections so they can take the necessary steps to protect their health. The frequency of testing will depend on an individual's risk factors and sexual behavior. For example, if a person is in a monogamous relationship and practices safe sex, they may only need to get tested once a year. However, if they have multiple partners or engage in risky sexual behavior, they may need to get tested more frequently, such as every 3 to 6 months. What tests should be done regularly? Here are some of the most common STD tests. Chlamydia and gonorrhea. These are two of the most common bacterial STDs, and they can be easily tested for with a urine sample or a swab from the urethra in men. HIV. This is a virus that can lead to AIDS, and it's important to get tested regularly if you're at risk. HIV testing can be done through a blood test or a rapid oral test. Syphilis. This is a bacterial infection that can be easily treated if detected early. Syphilis testing can be done through a blood test or a swab from a sore. Herpes. This is a viral STI that can cause sores and blisters around the genital area. Herpes testing can be done through a blood test or a swab from a sore. Human papillomavirus, HPV. This is a viral STD that can cause genital warts and is linked to certain types of cancer, such as cervical cancer in women. HPV testing can be done through a Pap test or a genital wart exam. It's important to note that not all STDs can be detected through testing, and some may take several weeks to show up after exposure. If you have symptoms of an STD, it's important to get tested and treated as soon as possible. It's also important to practice safe sex, including using condoms and getting vaccinated for preventable STDs. If you are sexually active, it's important to get tested regularly for STDs, even if you don't have symptoms. Early detection and treatment of STDs can prevent serious health complications and reduce the risk of transmission to others. Thanks for watching.